Hello, welcome to Walk in the Park. My name is Tony Ingram, and your host, and today is the 7th of May. This is episode 75, and we're going to continue a topic that we began last week, which is Lyme disease, its prevention and care, with Becca Harbour. This is part 2. That was part 1 last week. Becca Harbour, who is a naturalist, educator, herbal health expert, who's had a lot of experience and done a lot of research into Lyme disease. So last week she talked about, introduced resources which are on our website. That's walkinpark.com. You go there, get all of our shows on there, but if you go there, you can look for this same title, the Lyme disease prevention and care part 1, and you will find the handouts that came with the class that Becca taught, I think it was on the 24th of April at Green Star Market. And so there's some great materials there, a lot more stuff extending the class instruction and so forth. So this is a very interesting topic and very germane to our situation now with Lyme disease and deer ticks in the Finger Lakes and in Ithaca. So this week, let's see, what's she going to talk about? Let's see. Last week she talked about, knowledgeable practitioners. She explored some myths and varying medical opinions about Lyme and its prevention and treatment. Showed us a tick removal kit. Showed and discussed proper clothing to wear around deer ticks, and emphasized the importance of daily bodily tick checks. Okay, part 2, today she's going to talk about treating a tick bite, considerations about pets, tick repellents, and diagnosing Lyme disease. And the next episode, 76, we will go to the third part of the class. It was an hour and a half, and we have a half-an-hour show. So let's get right to it. Part 2, Lyme disease prevention and care with Becca Harbour.
Just so if you have your magnifier, you can see if it looks like a tick. And it doesn't matter what kind of tick, you want to get it out. So you have your tick kit with you, you pry it off, and then ideally, it helps to carry like a little teeny secure container of rubbing alcohol, with like some cotton, clean it off. There's, all kinds of antiseptic, antibacterial type of things you could put on it. There's like grapefruit seed extract ointment. If my bites, if it's an adult bite, especially, my bites always feel irritated afterward and itch. And I find that the rubbing alcohol, even though it was something I avoided putting on my body because I've heard it's not great stuff, but it really takes the itch away for quite a long time when I use it on a bite. And then one thing that's very soothing is, and you need to learn how to identify a plantain plant, but they're very common. They grow in a lot of lawns. And a narrow leaf plantain, maybe especially good, but you can use round leaf plantain. And you clean the leaf off, wash it off, chew it up into a green pulp, stick it on the bite, put a Band-Aid over it. I like the breathable Band-Aids, cloth Band-Aids, to hold it on because it will not stick by itself. And that is very soothing. Now, what Andrea Candide says, which was something I had never heard, was she said if you can get the peel of a ripe banana, one that has brown spots on it, then for the first 3 nights after you've gotten bitten, is take a piece of that ripe banana and put the inside against the bite and, can put it around with some tape or a piece of cloth to hold it on and sleep with that. And she said it's got a lot of enzymes and it draws toxins out and it draws. If the head got broken off of the tick, it can help draw the head out. And I know, like I had 2 bites on my neck. I think it was actually maybe the first year I got bitten. One that the head was still there and the other wasn't. And So I put the poultice, the plantain poultice, on the one the head was in, and that bite healed up and felt much better than the bite that didn't have the head in, that I didn't put the poultice on. It was very interesting. A lot of research has been done about all kinds of different illnesses, and the conclusion is that stress is one of the worst factors, biggest factors in illness. And so it really helps if you get bitten, or your loved one or your child, loved one gets bitten. The best thing to do is do whatever it takes to just stay as relaxed as possible. You know, you're going to just do the best that you can, and the more relaxed you stay, you know, the better you'll be, just in terms of your well-being, whatever happens. The other, well, I'm not going to go into pets, but that, you know, pets need to be checked every day, and they can bring, because ticks, I don't know if you know the life cycles, but basically there are 3 stages, larvae, nymph, and adult. And when they get to the point where it's time to turn into the next phase, they need a blood meal in order to have the energy and be able to transform. So, and the blood meal takes about 3 to 4 days, depending on the stage. So that means they're on an animal for that amount of time. So, you know, so a pet could bring in a tick that could be feeding if you don't find it and kill it, and then the tick, when it's done feeding, it drops off and it goes through a transition stage, I think, where it's pretty inactive while it, you know, digests the blood and goes through this, whatever this metamorphosis is, into the next stage. And so then you can have the next stage tick, you know, in your living space, or of course they're going to be, you know, outside, like where I live, they're around my house. And, yeah.
My vet said that the preventative tick vaccine for dogs will kill the tick, you know, so that if the tick feeds on it for 4 days and drops off, at some point it's a dead tick anyway.
Yeah, I was particularly thinking about
cats. You don't
pets
vaccinate,
that aren't, you know, treated, but
vaccinate.
But I'm not going to get into pets. All that there need to be considered, because if you have pets in the home, you have much higher risk than people who don't.
Do you want me to talk about pets for a minute?
Minute? Okay.
I'll briefly talk. So cats, you can't use permethrin on cats, and it's toxic to cats and fish. Permethrin is a big one for dogs. That's what we usually use for the topicals, the oils. There's a new collar called a Seresto, something like that. It's a new collar, you'll find it. It can be used for cats or dogs. It's flumethrin, which is a synthetic pyrethrin, but not toxic to cats and fish. So it's new, and cats are a big one for bringing ticks in. So really, if you have a cat or your friends have a cat, a lot of people let their cats outside, never thought about tick prevention.
Did you say the name of that collar?
I will get it on and I'll write it down, okay? And I did speak to a local natural vet, and she actually had from a good source that this flumethrin collar is safer than the topical stuff. So that's my quick.
And Andrea Candy, on her website, she says, and eucalyptus is one of the herbs, the essential oils that's been studied. It's supposed to be really a great tick repellent. And eucalyptus oil, essential oil. And the Oracacia oils at Green Star, they're all on sale right now, even though you don't see sale signs out, but they're all on sale. So Andrea Candy says her method is she takes a thin rope, which I would guess would probably want to be some sort of natural fiber absorbent. She says take a thin rope and like dip it in eucalyptus essential oil.
Straight?
Yeah, straight oil. And then it has to be long enough so it's going to be tied around the cat or the dog's neck. But then you wrap it in a bandana, roll it in a bandana, and then tie it around the animal's neck. And then you may need to refresh it with the oil a couple of times, different times during the week. So that's like a natural method, and she very much asserts that, and she gives, let's see, I brought, Here's Andrea. Here's Andrea. This, and I'm kind of jumping around a little bit. Her particular repellent approach is to mix a whole ounce of essential oil of eucalyptus into 16 ounces of water, which is like, what, a pint? You put that in a spray bottle, and you can spray your pet all over before they go out, okay? And you can also refresh the bandana. They've got the bandana and rope around their neck. You can spray this on your skin and on your clothing before you go out. So she says that for more lasting effects, you really need to put the eucalyptus in a carrier oil, which is the kind of things, if you buy any sort of insect repellent, like go to Green Star, you will see they have a base of citronella oil or soy oil or something like that. So she's saying in that case, her recipe is 1 part essential oil. So it might be, let's say, an ounce of eucalyptus oil to 7 parts of the carrier oil. Almond oil, grapeseed oil, all that kind of stuff could be. So that's one. There's not any one truth about repellents, but I will talk about the essential oils.
One part to
1 part to 7 parts of the carrier oil. Okay, yeah, I think we're pretty much on repellent. So I looked up what are actually the oils that have been shown to really work for ticks, and I put them on your sheet. Yeah. So the ones that have been studied include lavender, which is supposed to be really good for get rid of ticks and kill their eggs. Eucalyptus, oregano is very powerful. Geranium doesn't seem to have, I couldn't find anything that cited research, but it was recommended by a number of herbalists and other people. Lemongrass, couldn't tell that it was researched, but, and there's all kinds of other stuff. Alaskan yellow cedar, supposed to really do a number killing tick nymphs. Eastern red, this is all on your paper. Eastern red cedar, kill the larvae. And juniper, it's fairly unclear what this all means, but I think it's like essential oil from juniper, which if you go to Green Star, is a cedar wood oil. I'm sorry, no, Texas cedar wood. It's some kind of juniper, I think Mexicano. And these were others that I read too, Palo Santo, which I've never used. And several sources mentioned purification, which is, you can only get that through Young Living distributor. So you probably don't need to get purification, but that's my guess.
You say that's on our list?
Yep, up to lower chances of getting bitten. It's one of the, it's like the third thing under there about repellent. So the thing is developing the habit of using it, putting it on again. It's these things that do not necessarily last for a lot of hours.
And do you put the oils on your clothing or on your skin?
If you want, oils are going to stain your clothing like crazy. It's just like a repellent, like when you buy bug repellent, you put them on your skin. If you want to try that eucalyptus spray, or the other thing I brought was my friend just got through the internet. It's permethrin. This is a synthetic version of pyrethrum, which is from a plant. This is not.
Can you spell it? I'm sorry.
It's on your sheet.
Oh.
This, you dilute it 20 times. So, for...
It also comes in a spray that's already diluted.
Yeah, but this is like really cheap compared to
yeah.
buying anything. Like, he looked at Agway and it was like ridiculous. Right. So this is going to make 20 gallons. Okay?
Put it on your hat?
You take your, I did it with these 3 pairs of pants. I haven't done my hats yet. You go out, maybe hang them on a clothesline when there's wind's not blowing. And you might want to wear like some eye protection or any other protection. And you have diluted it properly. You spray it on your clothes so the clothes looks like it got wet. And you do the whole exterior of the clothes, and then you let that piece of clothing dry. And it did not stain at all. And that is supposed to last 6 weeks or 6 washings, whichever come first. But again, I would say don't count on that. You might want to do it sooner to put more on. This is a very inexpensive way to do it yourself. You can also do what a friend and I did when we didn't know anything else, which was LL Bean was the first place I knew to start selling permethrin-treated clothing. So I forgot to bring my LL Bean shirt, but they made pants. I have a pair of those pants. I have a long sleeve shirt. They have t-shirts.
70 washes.
They're very expensive, but they're called Insect Shield. And my friend just found out that if you go on Insect Shield website, you can get the same clothes for a lot less money.
Okay. And also Sierra Trading has them on.
So check the prices, but you can do this yourself, and it's all really cheap because you can get like a $3 pair of pants at Salvation Army, and then have your 20 gallons for $15, and you know you can't beat that. In my opinion, as somebody who likes to be really economical. So, yeah, and so if you have, like, if you do go out with non-rubber boots, because I don't really know that the permethrin's, you know, there's nothing to absorb on my boots, so, but if you have foot gear, you can spray that on, you know, again.
Oh, and the tick tubes.
Yeah, that's another thing, I think I have it on here. Maybe I didn't, but that's a whole other thing. I just bought my cotton balls today. Is you take the same dilution, you make it the same way, same spray bottle. Get a spray bottle, put a big thing on there saying poison. You do not want to confuse this with any other spray bottle. And this is actually my repellent bottle, but and this is another thing. You spray. You get cotton balls. You go outside. You spray the cotton balls so they get damp, you let them dry, and then you can pay a lot of money and buy these online. They're called Daminix, but
They're not that expensive.
well, but you can just take like, you know, narrow tubes. I don't know. We're going to try toilet paper roll tubes, and you just put some cotton balls in there and kind of tuck them away in little niches around your house or in your basement and around your yard or whatever, but kind of, I guess, tucked in little nooks, you know, maybe under bushes or the little, whatever, overhangs or whatever. And the idea is that the mice like cotton for their nests, and so they'll pick up the cotton. I haven't tried this yet, but I got the materials now. And
That's a good source.
I heard about this like 2 years ago, but this year I am doing a lot more to try to avoid even getting bitten, because I've gotten bitten 6 times at least every year for the last 6 years. So yeah. So so the idea is that they take the cotton back to their nest, and the result is that it kills the ticks on the mice. It doesn't kill the mice, but it kills the ticks. So then the mice are tick free.
It's questionable whether it kills the babies.
Oh yeah, I don't know, but
Yeah,
I guess personally I don't worry about it.
Right, I know. I mean, at this point with Lyme disease and
Yeah.
other co-infections, it's not worrying about babies.
So anyway, that's just another thing you can do with permethrin. The other thing I'll just add, which I want to try, because mice come in periodically, is taking the cotton balls, putting 2 drops of peppermint essential oil on the cotton ball, and sticking them in places where the mice tend to come in or hang out, because supposedly mice hate peppermint oil.
Mine like it.
Okay,
Just
well,
to let you know.
that's too bad. Sorry to hear that. Okay. All right, so let's talk, let's see. This is the other, I mentioned this at the bottom of the second side of your second sheet is, it is really good to have a symptom list. Now this booklet has 5 pages of symptoms for Lyme and co-infections. There may be symptoms that aren't on here because I have not compared them to, there's a big symptom list from a book that I borrowed from Teresa. But it's really good to, because if you get bitten or your kid gets bitten or your friend or whatever, it's really good to kind of be able to look through this enough to where you start to remember some of these. So if people get a symptom or 2 or 3, you will make a connection. Oh, this might be Lyme disease. And if you see it on the list, there's so many symptoms on this list. And this booklet was put together by the Lyme Disease Association of Southeastern Pennsylvania, And I didn't buy, because they don't sell them. They say, okay, how many do you want? And then they send them to you, and then I will send them, it costs them 50 cents to print this, which is a lot cheaper than if you Xerox put it on a copy machine. So I have them, if you want to give me 50 cents, it's going to go to them, and it has, you know, some basic information. I'm not saying that everything I'm telling you is exactly the same as in this booklet, but it's great to have a symptom list, because you want to just notice if stuff happens. And there are, you know, some of the general ones. It can be like the flu, fever, achiness. Some people get the joint pain or weird stuff with their joints. I never had joint stuff, but some people get rash stuff. Some people, you know, headaches. It can be heart stuff. It can be
Heart's a big one.
yeah. You know, some people get half their, you know, their face kind of gets paralyzed. Some people get stiff neck. You can just feel really tired, like I did last year. Brain fog, like you're just not thinking at all like you usually do. Like I had this very bizarre, wasn't pain, but it was very bizarre feeling through the whole top of my head that I felt like, what's the word? You know, just like, I can't remember the word I used, but this weird, cloudy-headed kind of thing that was all the time. I mean, and so luckily I wasn't in pain, but I felt like a couch potato, and luckily I had the energy to actually start to exercise. A couple of my friends said, "Becky, you've got to move around. You can't just like let everything go." And but when I talked to Deanna, she was saying, well, you know, some people, because I found I could walk a few miles and I wasn't exhausted at all, or I could ride my bike around Cass Park twice, which is 4 miles, and I was okay. And Deanna was saying, well, like a lot of people could never do that. You know, they're really, really exhausted. So there's all kinds of range of how bad anything can be. Some people don't get symptoms for ages. Dr. Stram said there are people who test positive and they have no signs of symptoms or problems or disabilities or anything. And of course, you know, we have different immune systems, we have different unique biochemistry. Some people I meet say the ticks don't seem to like them. They never get any ticks on them, you know, even though they're out in the woods too. And me, you know, I'm out in the woods and I, you know, got my share of ticks. So, you know, we can have different stories and different experiences. And then there's, you know, you can get emotionally, and this thing, yeah, you know, mood swings, depression, trouble sleeping. This whole pamphlet is focused on children by a number of different MDs and other Lyme literate people. And kids can start having problems in school. They're not able to do their homework. They can't think well. They can't do the kind of things they were doing. All of a sudden, they're not functioning properly. Some people get super light sensitive, super sound sensitive. You know, some people like have to curl up in the dark for, you know, all day long just to like deal. And that's usually more like chronic. But so I think it's really good to have a symptom list. You know, this is part of your kit, is be prepared. Let's see.
Can I just ask a question? So, on the common symptoms, like if you have a symptom that you can't explain in another way, and you get a Lyme's test and it comes back negative, at what point do you say, like, I want to look into this, like, just what you just basically have to determine yourself if you're going to demand for antibiotics and treat it, or like that's,
yeah, like, can I
you know, because
yeah,
I've had a random symptom for quite a while, and but I have never linked
well,
it
the
to
thing
this.
is that the most common tests, there's ELISA and there's a Western blot, and I know what was the Dr. Stram said, and ELISA is just worthless. That was a direct quote.
ELISA
and a lot of
test
times,
is
like I got a test at the hospital like 4 years ago. They didn't even know what the thing was called. The nurses, they didn't even know what the name of the test was. Oh, it was just the test for Lyme disease. I'm like, well, what's it called? Oh, you don't know. Western blot, from what he said, I already knew about Igenix, which is out in California, but Dr. Strand said the only two labs that you can get a better quality Western blot test are Stony Brook and IGeneX. And you know how to spell IGeneX.
Yeah, and I do both those tests. I
Yeah.
mean, if somebody needs it, but so, and there are some other tests out there now. They're just about $500-600. So some of my patients have negative tests or one band, and this is complicated, so I'm not going to get into it. But but there are some other tests if they're not getting better and they're not responding to treatment. Sometimes I'll do trials with certain types of treatment, like some nosodes or certain types of herbs, to see if there's a response, negative or positive. And then I'll go from there and decide, do we need to do a test? And sometimes I'll do provocative stuff, like doing an antibiotic and seeing, if there's a response. And if not, maybe I'll still do the test because it can provoke an immune response. Because Lyme will suppress the immune system. And that's the problem with getting a positive test on an immune test, like an immune globulin test, which is what they're doing. That's what a Western blot is.
A Western blot, and that's what you get if you went to like a typical
Yeah.
medical doctor.
And
Well,
so,
no,
yeah.
not necessarily.
No.
They
Oh,
sometimes
they'll do
want
an
to give you
ELISA.
ELISA first, and if you don't test positive on ELISA, then often they won't give you a Western blot, but tons of people will never get a positive on ELISA, including people who confirm Lyme.
They just pretend it's reliable.
So the thing that I want to say is that what I have read and heard from Lyme literate doctors and people is that diagnosis is primarily based for almost everybody on symptoms, on what has happened. And even if you haven't, to your knowledge, been bitten by a tick, if you have been bitten by a tick, you better believe that's a big reason to think that this is going on. But a good practitioner is going to look at all your symptoms, your history, where do you know if you got bitten by a tick? But even if you weren't, if you live in a place where the tick and Lyme disease is really happening, like here, there's a really good chance that that's what's going on.
Okay, so that's the end of part 2 of this series about Lyme disease prevention and care. So that's what we're doing today. But if you want to review this, you can go to my vid blog at walkinpark.com and find these the same title, Lyme disease prevention and care. You can see part 1, part 2, and we'll be doing part 3 next week, and there'll be lots more to talk about. So I want to thank you all for joining us here, and take care. Use some of the advice that Becca and Deanna have given us. It's very important for maintaining our health. Okay, have a good week.